Hi, everyone. I'm so glad you're here. I wanted to share with you a document that I created that may help us in figuring out who the best therapists are for our children. So it's a guide, and a full disclaimer here, it is only a guide. I am adding to it all of the time. It's not perfect, but I think it's helpful. So it's a guide for hiring prospective therapists for parents who have children who have been coercively controlled. To be really clear, what I say all of the time, and it's why I created the protective parenting program, is that the best supports for our children are their protective parents who are coercive control and trauma informed. And that's what I try to support people in being with their children. The coercive controller is going to sabotage any attempts or most attempts for your children to have therapy, or worse, they may actually be okay with it and then they will align with the therapist or the therapist will align with them. I want to be really clear. There are amazing therapists out there who do such stellar work. However, there are many therapists who might be trauma trained. And again, therapists should be trauma trained. It's different than trauma informed, but they might be trauma trained, but they may not be coercive control informed. And that's the missing piece because every single trauma that children are experiencing in these relationships is a layered effect of coercive control. It is beyond. So traumas are horrible and horrifying. Certainly a death, the loss of a parent, again, it can be a variety of things, any kind of abuse, right? But the problem with coercive control is it is often very insidious. It is not, we do not look at domestic abuse and child abuse beyond the violent incident model. So if there are no bruises, if there are no allegations and no disclosure of sexual abuse, horrifying as all of those are, then we often say, well, then abuse didn't occur or the child is fine. We all know better. All of us in this world of coercive control know better. We know our children are traumatized. And so, really understanding what we can look for in a therapist that might be best to support our children. First and foremost, again, there's not a lot of therapists who have this significant extra lens of coercive control. There's not. But if somebody's willing to learn about it, if they're willing to engage in the conversation, oh my gosh, that's half the battle. Okay. So here's the questions. Does this therapist have an interest in advocating for victims and survivors on all levels, micro, meso, and macro? I think it goes without saying that if this therapist has experience with this personally or someone they love, then that is going to be that much more relevant to your situation. They're going to get it more because the biggest problem with coercive control is that people can't wrap their head around how horrifying it is, how awful it is. And so someone who gets it, that's going to be helpful. These are people who understand that it happens on this intimate partner relationship experience. The children can be coercively controlled. They understand the meso level. They understand that agencies, child protective services, the judicial system, the criminal justice system, these systems also are complicit sometimes, oftentimes, in diminishing the experiences of victims and survivors. And they're interested in the macro level. They may not know that 5 states in the United States have codified coercive control as a form of domestic abuse. They may not know that in the UK it's criminalized, and in other countries they're working towards that or it's already occurring. They may not know that, but when they hear it, they're happy about it and they're grateful and they're going to get more engaged. They may not know about Violence Against Women's Act with Caden's Law. The VAWA Act with Caden's Law actually is requiring, state by state, sadly, Colorado has now passed it, but that there are people trained to understand what is the best interest of children. So these are really important factors. Social justice advocacy is imperative to changing the systems, and they need to know that. And they need to be open to hearing new information. They need to be trauma trained. Again, this is different than trauma informed. We hear that word a lot, that phrase a lot. That's not the same. People who are trauma trained are clinicians who actually go through trainings and gain CEs to do that. And they need to have experience working with victims and survivors in some capacity, whether it's children who have been traumatized. There are amazing evidence-based theories out there, therapies and evidence-based practice that works with people who have been traumatized. EMDR, mind mapping, certainly things like TFCBT, trauma focused cognitive behavioral therapy. Those are great. but they are not going to help a child who doesn't actually recognize they're being abused. And so that's part of the problem with these children, right? Is they often are in the mix of it, highly confused, very traumatized, dysregulated in a variety of ways, whether it's disassociating, whether they're in that anger mode, whether they're in that withdrawn mode, whatever it is, they are having those reactions, but nobody understands that that is related to them being covertly, coercively controlled. And so we have to actually deal with that first as therapists. That has to be the first thing. And so I will talk about that a little bit more further on. They need to have an understanding of coercive control as this additional layer, as a lens to look at the trauma of living in a family system with an abuser. This is so important. They need to understand that children need to be educated on what unconditional love and positive regard is, and that every child deserves to feel this and the ability to be authentic with one of their caretakers. This is the crux of it. Children in these situations do not understand or do not feel unconditional love from the abuser because they know the abuser will only love them if they do X, Y, and Z. However, the tricky part is the abuser is also telling them, projecting this onto you and saying you don't love them unconditionally. And then sometimes when they misbehave and you correct them, they actually feel shame and they feel that you don't love them unconditionally, even if you do. They feel like they can't be authentic, or sometimes they're extremely authentic with us, coming home and projecting all of their anger onto us. And because we are victims, right? Sometimes we're reactive. That doesn't help their situation. So really the crux of their getting healthy is going to be to help them discern the difference between not necessarily ever disparaging the abuser, but discerning what the difference is between conditional and unconditional love. Where can you be yourself? How can you behave in certain circumstances? And again, I think it's really important to understand these children have been indoctrinated oftentimes into a false narrative. And so they might come in to therapy saying bad things about you, the protective parent, because that's the narrative they've been given. They need to be validated in that. Absolutely. But then they need to be able, this therapist needs to be able to give them clarity. This is so important. And again, it's not your mother's not bad and your father is. It's okay. So tell me what you feel in your body. What are the feelings you get when you are at maybe mom's and you're eating dinner? What are the feelings that you have? Now, remember, they're going to have some negative feelings because they're being told negative things. But the idea is to get deep inside of there and help them to recognize that with mom, they are safe if mom is the protective parent. And with dad, maybe they are not safe. Okay. So these are really important things to keep in mind. Understand that this therapist needs to understand that two-parent model is not best for children. When one parent is a coercive controller, it's not best for children. We need to keep our explanation of our relationship to a minimum. I escaped a coercively controlling relationship, and I believe that my child has been and is being coercively controlled. That's it. We don't have to give a lot. Now, they might need a back history, and at some point you're going to give them more, but we want to keep it really succinct. We want to keep it short because here's the thing. The moment that we are telling our whole story, which many of us feel so, that's a cathartic process when you're able to share that. You do that with your own therapist. You don't do it with your child's therapist because here's the thing. Then you're perceived as a victim. Then you're perceived as not advocating for your child, even though you are perceived in some ways as maybe not being as stable. Now, I get that that's a wrong belief system. I'm just trying to be really pragmatic here. What is the best way to behave with this therapist? You come off with a sense of personal power, that you are trying hard to advocate as best as you can for your children. Yes, this happened to you, no denying it, but this is about my child and what their experiences are. Keep the focus on your child's needs at all times. This will reaffirm for the therapist that you are not in the role of the victim, but you are in the role of advocate for your child. That's your primary role. And I know it's your primary role, but we have to relay that messaging. This personal power will relay that messaging about you being stable versus the instability of the coercive controller. A good therapist will never minimize your child's experiences, nor minimize the behaviors of the coercive controller. A good therapist will understand the insidious nature of this and how it is so difficult to discern for It was difficult for you to discern, and it's difficult for therapists to discern. They have to figure out, and we need them to become more adept at figuring out who the coercive controller is. And that's not really difficult, and I'll talk about that. That is really about looking at the pattern of behavior that's been going on in this family system and understanding that when someone is feeling like they are trapped, that they can't get out, that they're going to behave or align much like Biderman talks about in his coercion chart. They're going to align with their oppressor. That's what our children are doing. A good therapist will support your child having agency, but it's important. They need to support your child having agency, and then they need to be able to give your child clarity. Lastly, I want you to use your intuition. I know this is hard. The coercive controller literally stripped away a great deal of your autonomy and your agency. We're assuming he, because most of these perpetrators are men, no question about it. Let's be really clear. Any of the statistics related to men as victims of domestic abuse are inflated because of DARVO, because of this ability for perpetrators to flip the narrative onto victims and survivors. So use your intuition. Does the therapist seem to understand the gravity of the situation and the egregious behavior projected onto your child by that coercive controller? And I want you to think about it. Okay, feel your body. Does this feel right? This is about you healing in this process. We heal in synergy with our children. This is about you healing in that process. So I'm going to go on to this one first section for this video, and then the next section we'll cover next video. Does the therapist understand the concept of coercive control? You know, you can ask them, are you familiar with the concept of coercive control? And they might be like, no, I mean, I've heard of it, but I'm not really clear. Well, it's the foundation of virtually all domestic abuse. It's based on power and control, one person exerting power and control over another. It's beyond the violent incident model. Domestic abuse does not have to be physical in nature to be abusive. It's insidious and covert. It may include psychological abuse, legal abuse, financial abuse, sexual abuse, and use of the children as weapons. And that's why I'm here, because my children are being weaponized against me. The psychological abuse can include gaslighting, manipulation, isolation, and intimidation. You may need to explain this concept to the therapist, as it's relatively new in our vernacular. However, they should have an aha moment and clearly understand that virtually all domestic abuse is based upon a pattern of power and control, with one person exerting this power and exerting this control over another, both adults and children. No matter how much a child seems to adore their parent, if there's been a pattern of power and control over the adult victim in the home, we have to assume it's been happening to the children. We have to assume there is an indoctrination that's been occurring. Are you familiar with the Duluth model of post-separation abuse and the power and control wheel? Yes, I am familiar with this research-based model created by researchers in Duluth, Minnesota in the 1980s. These wheels literally were the wheels that began to share with us how power and control is exerted in intimate relationships. You may want to ensure that they agree with the aspects of how children are weaponized, clearly illustrated on the Duluth post-separation abuse wheel. Perhaps bring copies with you. That's why I have links there. And then what we're going to talk about next time is, does the therapist understand that most coercive controllers have a pathology that cannot be healed, and that coercive controllers are often able to hide who they truly are? This is important because when the abuser shows up to therapy, there's a performance going on, right? They're performative. They are charlatans. They behave as if they're calm and everything's fine while you are a nervous wreck, reasonably so, because your children are being so traumatized. And so what do we need to do? We need to make sure that the therapist understands how these people present, and that they're able to discern the difference, and that they're willing to support you through the process of disengaging, of having your children learn and discern the difference also, in a way that does not disparage the coercive controller, because we never want it used against you, ever. But we want a therapist who can see this clearly. So I hope that's really helpful too. I will be back with another YouTube video to go through the rest of this. And I certainly have the information on my website too. www.iknowyourheart.com, and follow me on Instagram and Twitter at Dr. Cochiola, Coercive Control. Thanks so much, everyone. Have a great day.